Well, what is it about the way you handle these problems that makes it different from a traditional practice?
There has been a lot of research into the area of hormones. Unfortunately, all the research from the US has been driven by big pharma and by one drug company in particular that did this study on hormones that came out in 2002. I'm sure you've heard all the information about hormones, how they're bad for you and how they increase your risk for breast cancer and all those other things. What you have to understand is that is one particular kind of hormone treatment called Prempro.
Okay, I've heard of that.
Right. It doesn't apply to what we're doing here. There is all kinds of great medical evidence. In fact, I have a notebook in my office that's this thick and getting thicker every day that tells us that hormones can be beneficial and that hormones are good for you. Most of that evidence is coming from Europe or from Australia or somewhere else, but they're very well designed studies. It's reputable evidence. The problem is you don't hear about it here in the States, and physicians won't hear about it unless they're searching for it. And frankly, you see 30 or 40 people in a day, then you have a couple hours to finish up with paperwork or your computer work for your electronic record afterwards. The last thing you want to do is get on the internet and find out what's new in medicine.
So what's the difference about what we hear and what we might see on television and the hormones that you're using?
The key to a hormone is that the structure determines the function. So in other words, the actual shape of the hormone determines what happens in our bodies. So with, for example, the studies that we hear about were with a medication called Prempro, okay? Prempro was a drug that was made from conjugated equine estrogens, which means horse pee hormones.
Oh my.
So you think of the name Premarin, pregnant mare urine, okay? And then Pro, which is the progesterone-like component. It's called a progestin. They were invented for use in birth control pills, okay? So we took these two compounds that the body doesn't recognize fully, we put them together, and we treated women for menopause, all right? The difference is what we're doing now is using what's called a bioidentical or human identical hormone. What that means is the structure of the hormone is exactly the same as what your body would make itself. So the estrogens look exactly like the estrogens your ovaries made. The progesterone, exactly like the progesterone your ovaries made, and the testosterone, exactly like the testosterone your ovaries made.
That makes sense, because then our body would know what to do with it.
Exactly. It allows the body to fully recognize the hormone, to fully utilize the hormone, and then, importantly, to metabolize the hormone and get rid of it. So when this hormone that we're using comes into your body doesn't know the difference from that or something that it's made itself. So it knows exactly what to do with it. And that's a huge difference.
So thinking about safety, I've heard before that hormone replacement could increase my risks of breast cancer. Would you speak to that?
Sure. One of the most common misunderstandings that we have is the safety of hormones. So we go back to that study before done with Prempro. That study was the World Health Initiative study. That study is the one that's been followed through the United States for over 10 years now. And that first piece of data that came out in 2002 said hormone replacement put women at an increased risk for breast cancer, an increased risk for stroke, an increased risk for heart disease, and an increased risk for blood clots. Well, if you think about that, it's kind of a no-brainer. We shouldn't be doing it at all, right?
Right.
Of course. So here's the part that you don't know. Prempro, like we talked about, is a non-bioidentical. It's not estradiol. It's not progesterone. It's not testosterone. It acts differently. In France, they've done studies that were just on the bioidenticals, specifically estradiol and progesterone. There was one study that came out in 2005 where 54,000 women had been on estradiol and progesterone plus or minus 7 years, okay? And those women showed that there was no increase of breast cancer, decreased risk of cardiovascular disease, and decreased risk of osteoporosis. So what we can conclude is that Prempro is bad for us, without a doubt.
Right.
However, bioidentical hormones, the studies have shown that that kind of treatment can be very beneficial. And most importantly for women in America who are so concerned about breast cancer, those studies showed there was no increased risk of breast cancer in those women.